Want to turn now from terrorism to another important issue for many Americans, the financial squeeze on the middle class. For that, we go to my CBS News colleague, Nancy Cordes. Nancy?
John, thanks so much. We've learned a lot during the course of this campaign about the things that you'd like to do that you say would help the middle class, but we haven't learned quite as much about who would pick up the tab. So, Secretary Clinton, first to you. You want to cap individuals' prescription drug costs at $250 a month. You want to make public college debt-free. You want community college to be free altogether, and you want mandatory paid family leave. So, who pays for all that? Is it employers? Is it the taxpayers? And which taxpayers?
Well, first of all, it isn't the middle class. I have made very clear that hardworking middle-class families need a raise, not a tax increase. In fact, wages adjusted for inflation haven't risen since the turn of the last century after my husband's administration. So we have a lot of work to do to get jobs going again, get incomes rising again. And I have laid out specific plans. You can go to my website, HillaryClinton.com, and read the details. And I will pay for it by, yes, taxing the wealthy more, closing corporate loopholes, deductions, and other kinds of favorable treatment. And I can do it without raising the debt, without raising taxes on the middle class, and making it reasonably manageable within our budget so that we can be fiscally responsible at the same time.
But a quick follow-up on that $250 a month cap. Wouldn't the pharmaceutical companies and the insurance companies just pass that cost on to the consumers in the form of higher premiums?
Well, we're going to have to redo the way the prescription drug industry does business. For example, it is outrageous that we don't have an opportunity for Medicare to negotiate for lower prices. In fact, American consumers pay the highest prices in the world for drugs that we helped to be developed through the National Institutes of Health and that we then tested through the FDA. So there's more to my plan than just the cap. We have to go after price gouging and monopolistic practices and get Medicare the authority to negotiate.
Governor O'Malley, you also want to make public college debt-free. You want states to freeze tuition. You've got your own family leave plan. How would you pay for it? In Maryland, you raise the sales tax, you raise the gas tax, and you raise taxes on families making over $150,000 a year. Is that the blueprint?
Now, Nancy, the blueprint in Maryland that we followed was, yes, we did, in fact, raise the sales tax by a penny, and we made our public schools the best public schools in America for 5 years in a row with that investment. And yes, we did ask everyone, the top 14% of earners in our state, to pay more in their income tax, and we were the only state to go 4 years in a row without a penny's increase to college tuition. So while other candidates will talk about the things they would like to do, I actually got these things done in a state that defended not only a AAA bond rating, but the highest median income in America. I believe that we pay for many of the things that we need to do again as a nation, investing in the skills of our people, our infrastructure, and research and development, and also climate change, by the elimination of one big entitlement that we can no longer afford as a people. And that is the entitlement that many of our super wealthiest citizens feel they are entitled to pay, namely a much lower income tax rate and a lower tax rate on capital gains. I believe capital gains, for the most part, should be taxed the same way we tax incomes from hard work, sweat, and toil. And if we do those things, we can be a country that actually can afford debt-free college again.
Senator Sanders, you want to make public college free altogether. You want to increase Social Security benefits, and you want to spend $1 trillion on infrastructure. So you've said that to do some of these things, you'll impose a tax on top earners. How high would their rate go in a Sanders administration?
Let me put those proposals, and you're absolutely right. That is what I want to do. That is what has to happen if we're going to revitalize and rebuild the crumbling middle class. In the last 30 years, there has been a massive redistribution of wealth, and I know that term gets my Republican friends nervous. Problem is, this redistribution has gone in the wrong direction. Trillions of dollars have gone from the middle class and working families to the top 1/10% who have double the percentage of wealth they now own. Yes, I do believe that we must end corporate loopholes such that major corporations year after year pay virtually zero in federal income tax because they're stashing their money in the Cayman Islands. Yes, I do believe there must be a tax on Wall Street speculation. We bailed out Wall Street. It's their time to bail out the middle class, help our kids be able to go to college tuition free. So we pay for this by demanding that the wealthiest people and the largest corporations who have gotten away with murder for years start paying their fair share.
Well, let's get specific. How high would you go? You've said before you'd go above 50%. How high?
We haven't come up with an exact number yet, but it will not be as high as the number under Dwight D. Eisenhower, which was 90%. But it will be. I'm not that much of a socialist compared to Eisenhower. But we are going to end the absurdity, as Warren Buffett often reminds us.
That's right.
That billionaires pay an effective tax rate lower than nurses or truck drivers. That makes no sense at all. There has to be real tax reform, and the wealthiest and large corporations will pay when I'm president.
And may I point out that under Ronald Reagan's first term, the highest marginal rate was 70%. And in talking to a lot of our neighbors who are in that super wealthy millionaire and billionaire category, great numbers of them love their country enough to do more again in order to create more opportunity for America's middle class.
Secretary Clinton, Americans say that health care costs and wages are their top financial concerns, and health care deductibles alone have risen 67% over the past 5 years. Is this something that Obamacare was designed to address, and if not, why not?
Well, look, I believe that we've made great progress as a country with the Affordable Care Act. We've been struggling to get this done since Harry Truman, and it was not only a great accomplishment of the Democratic Party, but of President Obama. I do think that it's important to defend it. The Republicans have voted to repeal it nearly 60 times. They would like to rip it up and start all over again, throw our nation back into this really contentious debate that we've had about health care for quite some time now. I want to build on and improve the Affordable Care Act. I would certainly tackle the cost issues, because I think that once the foundation was laid with a system to try to get as many people as possible into it, to end insurance discrimination against people with pre-existing conditions or women, for example, that yes, we were going to have to figure out how to get more competition in the insurance market, how to get the costs of particularly prescription drugs but other out-of-pocket expenses down. But I think it's important to understand there's a significant difference that I have with Senator Sanders about how best to provide quality, affordable health care for everyone. And it's a worthy debate. It's an important one that we should be engaged in.
It is a worthy debate. Senator Sanders, a quick response, and then we'll get into health care again later.
I am on the committee that helped write the Affordable Care Act. We have made some good progress. Now what we have to take on is the pharmaceutical industry that is ripping off the American people every single day. I am proud that I was the first member of Congress to take Americans over the Canadian border to buy breast cancer drugs for 1/10 the price they were paying in the United States. But at the end of the day, no doubt, the Affordable Care Act is a step forward. I think we all support it. I believe we got to go further. I want to end the international embarrassment of the United States of America being the only major country on earth that doesn't guarantee health care to all people as a right, not a privilege. And also, what we should be clear about is we end up spending, and I think the Secretary knows this, far more per capita on health care than any other major country, and our outcomes, healthcare outcomes, are not necessarily.
And Nancy, I really wish you'd come back to me on this one, John, because we've actually found a way to reduce hospital costs. So whenever we come back to
Governor, you're breaking the rules.
I'd like to.
I'm sorry, we're going to have to cut for a commercial. We'll be right back here from Drake University in Des Moines, Iowa.
Thank you.
It cannot be an American fight. We will support those who take the fight to ISIS.
This actually is America's fight. It cannot solely be America's fight.